Hello, today we're going to talk about the management of emergency department headache patients with the focus on life-threatening headache and COVID-19 implications. My name is Ed Sloan. I'm Professor Emeritus at the Department of Emergency Medicine at the University of Illinois at Chicago. I've been an attending physician at Carle Foundation Hospital in Champaign, Illinois, and I'm Medical Director of the Physician Assistant Studies Program of Dominican University in River Forest, Illinois. I've practiced emergency medicine for 35 years, and I hope my experience and this educational effort will improve your care of patients with acute headache emergencies. I'd like to thank Sam Ashu, who helped us with the EB Medicine podcast that was recently recorded, and I'd like to thank Erica Scott, Angie Wallace, and Stephanie Williford, all of the EB Medicine group. EB Medicine has done a great job in providing monographs monthly that cover emergency medicine topics for the past 26 years. I'm FERNE President and Board Chair. I have no financial conflicts, and I do note that EB Medicine supported the development of this slide presentation. Our educational objectives. We want to provide the platform for increasing competence, which includes knowledge and strategies for using that knowledge and improving patient care. We want to improve performance in practice and ultimately improve patient outcomes. Specifically, we want to talk about secondary headache etiologies that are life-threatening. It's important to know how these ED patients present. We need to be able to diagnose and treat these patients effectively, and we'll consider headache and other COVID-19 factors. An overview. The content literature, this information provided comes from the monograph Evaluation and Management of Life-Threatening Headaches in the Emergency Department by David Zada, Gabriel Procopio, and Amit Gupta. It's part of the Emergency Medicine Practice Series. It was published by EB Medicine in February 2019. This is the Emergency Medicine Practice cover that includes the information and the editorial board. When considering the diagnosis and treatment of emergency department headache patients, especially in the setting of this current COVID-19 pandemic, the following can be concluded. Emergency department headache patients who present with potential life threats can be identified. In order to do so, a systematic evaluation is critical, and the electronic medical record can help with this process. Most importantly, sub-arachnoid hemorrhage can be excluded in patients who present with sudden severe headache, given our current diagnostic capabilities. Also to be noted, head and neck infection, CNS infection, and CNS thrombosis must be considered if subarachnoid hemorrhage is excluded as the likely etiology for patients with potentially life-threatening headaches in the emergency department. During the time of this current COVID-19 pandemic, it is possible that common primary etiologies of headache, such as muscle tension headache, migraine, or even headache related to dehydration, can commonly be seen in emergency department patients. However, when considering patients with potentially life-threatening headache in the emergency department, at this time it is worthwhile to always consider COVID-19 as a potential etiology of these life-threatening headaches. During the time of this COVID-19 pandemic, besides specifically testing for the COVID-19 virus, there's no need to specifically alter our approach to diagnosing and treating patients in the emergency department with life-threatening headaches. If you have any specific questions related to this educational content, please send an email to fern.org@gmail.com. We encourage you also to go to the fern.org website for more content related to this educational program, as well as other content related to the care of patients who present to the emergency department with life-threatening illness and injury related to neurological emergencies. Thank you.